Good day, class. In this video, we are going to study stomachache. Stomachache is a sensation that the patient may experience pain in the upper abdomen or right below the heart. Chinese medicine understood stomachache as early as Huangdi Neijing. In Ling Shu, the second volume, it described that patient may suffer from stomachache. In the meantime, the patient may present as distending sensation in the abdomen. The pain may present in the upper abdomen, right next to the heart. So that's the original description of stomachache. Described that the stomachache may happen in the upper abdomen, very close. The location is very close to the heart. In 伤寒杂病论, the author also described that the patient may present the pain right below the heart. As you can see from this description, below the heart, which means the author Zhang Zongjing, he realized that this pain is not the pain in the heart, it's right below the heart. So he used another prescription for stomachache. But in general, from Huangdi Neijing to Song Dynasty, Chinese medicine didn't separate the heart pain and the stomachache. So it describes heart pain or it describes the pain in heart, just in general. But after Song Dynasty, practitioners, they realized that the stomachache and the pain in the heart or the heart attack, these two diseases are different. So in Song Dynasty, there's one author. He recorded that there are different types of pain in hearts. He described 9 different types of heart pain. And one of the heart pain, he described that the pain is the location of this pain is very close to zone 12. And this is actually the stomach, not the heart. So from Song Dynasty, especially after this book, the practitioners afterwards, they separate the heart pain and the stomachache. So even in the text after Song Dynasty, some books, they have specific chapters on stomachache. This is the development of Chinese medicine. After Song Dynasty, we separate the heart pain and the stomachache. From this point of view, we also need to be careful that in our future practice, when we see a stomachache, we need to exclude the possibility of a heart attack, especially the atypical heart attack, such as in senior patients or in patients with diabetes. As they are more likely to suffer from atypical heart attack. The most common pathogens that may result in stomachache includes exogenous pathogens, improper diet, emotions, or spleen and stomach weakness or deficiency. Exogenous pathogens such as the coldness, the heat, dampness, when they attack the stomach, it may result in a stagnation of the stomach, and the stagnation will result in pain. So again, whenever we talk about pain, it may be the blockage or the stagnation or malnourishment of specific areas or organs. These two are the common pathogenesis of different types of pain. Improper diets includes greasy food, hunger, or overeating. These may result in the dysfunction of spleen and stomach. it may result in stomach qi stagnation. The improper diet also can be the improper type of food, such as greasy food, spicy food, alcohol intake. These may result in internal heat, which also may affect the stomach. The liver dysfunction here mainly refers to the emotions, especially the emotion of anger or worry. These may affect the liver and the spleen. The liver will affect the spleen and stomach. The stomach is related to the spleen, which is also belongs to the earth. So the liver may affect the earth. In this situation, this patient may present as anxiety or depression accompanied with stomachache. In a more common situation, especially for the chronic stomachache, the patient may present as depression. The last common reason is the spleen and stomach weakness. This is related to the body constitution of especially the yang deficiency of the middle jaw. So all these pathogens or these factors may result in blockage of the stomach, or either blockage or malnourishment of the stomach will result in stomachache. So the pathogenesis of stomachache is mainly due to these two: the location of the disease. Obviously, it is the stomach, but it's also related to the liver and the spleen. In the acute stage, in the early stage, mostly are the excess syndrome. In a chronic situation, most of them will result in deficiency. So these also will affect your treatment principles. At the beginning, you're going to reduce the pathogens because this is excess. But in a chronic situation, you will try to tonify the spleen and the stomach. Apart from these common reasons, these factors also may result in other consequences, such as cholestasis. The spleen-stomach deficiency may result in bleeding, such as vomiting blood or black stool. Apart from treating the symptoms, it is also very important to find the causes. To differentiate different diseases, that's from the slides, the common medical conditions. That's something we need to differentiate. Also, for a patient presents as stomachache, we need to think about the heart attack, abdominal pain that we're going to introduce in the next few videos, and other common medical conditions that we need to differentiate. In the study of the clinical acupuncture, when we discuss specific diseases, it is very important to think about the differentiate diseases. What diseases that we need to differentiate when we see one specific disease? Because this will help you to exclude some other common and similar diseases. Patient presents as stomachache accompanied with tar stool. The stool looks like tar. This is a sign of internal bleeding, such as the upper gastrointestinal bleeding. For the syndrome differentiation, firstly, we need to differentiate it is an excess or deficiency. It is cold or heat. Is this the qi is affected or the blood level is affected? For instance, In excess situation, the patient may present as severe pain, a fixed location. The patient doesn't like to be pressed on, a large pulse, deficiency, mild pain, and the region, the location of the pain is not that clear. The patient prefers to be pressed on, weak pulse, deficiency and excess. From heat and cold perspective, a stomach ache can be aggravated by coldness, the cold weather, cold food, cold water. It's the cold. Some can be relieved by warmth. So that's why sometimes the patient will use a hot water bottle put in the upper abdomen. This can help you to identify the coldness. If accompanied by qi stagnation, the sensation may be distending feeling. The patient also may present as nausea, vomiting. Qi deficiency, spleen and stomach deficiency. This will be accompanied by the other symptoms that's related to qi deficiency. So these are different symptoms and signs that you can gather as your evidence to support your diagnosis. The treatment principles of stomachache, you're going to activate the qi stagnation, stop the pain. So that's the two principles. Activate the qi circulation. Firstly, to activate the qi circulation. Second, to stop the pain. So these are the symptom differentiation. I'm not going to go through one by one. You can find the main symptoms, and then you can find the accompanying symptoms to support your diagnosis. Insufficiency will result in deficiency heat. So you can find some symptoms that can support insufficiency. Coldness, the first and the third are quite similar. Spleen and stomach internal coldness and pathogenic coldness in the stomach. Both of these are due to coldness. The only difference is the spleen and stomach internal coldness. This coldness is due to yang deficiency, results in internal coldness, which means this is a deficiency syndrome. Pathogenic coldness in the stomach, this is due to exogenous pathogens. This is an excess syndrome. So the treatment principles will be very different. Dispel the coldness. This one will be tonify the spleen yang or the stomach yang. The food retention. The foul smells. In conventional medicine, many of this patient will go to the dentist because they think this is the bacteria in the mouth. But from Chinese medicine, we're going to treat the stomach. This is the long-term solution for this problem. So the foul smells are not from the mouth, it's from the stomach. But it doesn't have to be food retention. it also can be internal heat due to other reasons. That's why we don't use the medical term of foul smell, because the medical term already give you definition that's due to the problem in the mouth. So we still use the symptoms, and then the symptom of foul smells, and then you won't limit to the problem in the mouth or in the gum. The treatment method. We've already mentioned the treatment principles to stop the pain, to activate qi circulation, and then how to achieve these principles or how to achieve these aims. For spleen and stomach deficient internal cold, you're going to use a combination of acupuncture and moxibustion. In deficiency, the treatment principles will be tonifying in and clearing heat. Use acupuncture, reinforcing, or even manipulation technique. So we need to separate the principles. These are the principles and the techniques. So when in the test, when the question is asking about treatment principles, all one looking for is this phrase. What you could want to do. The treatment principles are from the syndrome. Some deficiency, because in deficiency, you're going to tonify in, you're going to clear heat of the deficiency heat, and then you can follow by your treatment method. Because we mainly study acupuncture, we only introduce the acupuncture techniques. And then for herbal medicine, you're also going to follow this principle. So from the symptom of the patient, the syndrome of this patient, the principles, or from the patient all the way to this level, there will be no change. And then the only difference is we're going to use acupoints instead of using herbal medicine. So those are the treatment principles. The liver qi, regulate the liver qi. Which points can we use to regulate the liver qi? Such as liver 3, large intestine 4, food retention, blood stasis. The main points: Rung 12, stomach 36, pericardium 6, spleen 4. Rung 12 is the front move points of full organs. This is one of the reasons is the front move points of full organs. The stomach is one of the full organs. Rung 12 also close to the location is also close to the stomach. So it's both the local points, also for special category. Number 36. So this is one of the most important points of the stomach. From the clinical experience, all diseases that's related to the abdomen, the stomach, we can use stomach 36. Stomach 36 is also the low C points. Pericardium 6 and spleen 4. Pericardium 6 belongs to the pericardium. Pericardial meridian is the hand sanjiao meridian. The sanjiao has the function, if you remember the function of sanjiao in the basic theory, is the pathways of the qi and blood movement. So when you select the points on the sanjiao meridian, it can help to regulate the qi circulation, the blood circulation. The pericardium 6 also links to the in-heel meridian, in-link meridian. spleen 4. This is a low connecting point of the spleen. It can regulate the spleen and stomach function to stop the pain. This is also the meeting points. Is where the tone meridian meets with the spleen. The pericardium 6 and spleen 4, these two are very commonly used as a pair of acupoints for anything related to the stomach, to the abdomen region. Patient presents with spleen deficiency, we can use Moxibustion. Room 8, room 6, blood 20, blood 21. We can use reinforcing technique or Moxibustion. In deficiency, blood 21, kidney 3, stomach, spleen 6. So we can tonify the yin. Acute, especially for acute stomachache, pathogenic coldness doesn't have to be coldness. If acute situation, we can always use stomach 34. This is the C cleft point of the stomach. In the acute stage, if the patient comes to you and presents with severe stomachache, you can needle this point with strong manipulation technique. Sometimes the patient may feel relief immediately after a few minutes. So stomach 34 will be one of the first points that you need to think about in the acute stomachache. Level qi stagnation. Level 14, level 3, large intestine 4. Blood stasis, 膈腧, blood 17, 20 points. Food retention, stomach 21, room 11. Needling technique for stomachache. In the acute stage, we apply once or twice a day. In the chronic stage, you can apply once a day or every second day. And you also can use auricular acupuncture. If you don't have acupuncture needles, you also can use your thumb to press on the above points that we have mentioned. In this video, we mainly discuss stomachache. It is very important to understand the etiology of stomachache, the pathogenesis of stomachache. Also, we need to memorize the common points, such as room 12, the local points, also the front mu points, the stomach 36, pericardium 6, spleen 4. Thank you for your attention.